Brachial plexus is probably the most important material regarding the upper limb. Why? Because most of the equations and most of the clinical scenario coming from the brachial plexus. So, definition of the brachial plexus, what is it? It's brachial plexus, that is the somatic plexus to supply upper limb. We'll talk a little later what's the difference between the somatic and autonomic plexus. The somatic plexus supply muscles of skeletal muscles of our body, supply soma. Autonomic plexus supply viscera or internal organs. Okay, this specimen actually demonstrates to us all parts of the brachial plexus, starting from the roots of the brachial plexus. These 5 structures, in reality, they are roots of the brachial plexus. Brachial plexus originate from the spinal nerves, specifically not from the entire spinal nerves, but only from the ventral anterior rami of the spinal nerves. We have in our body 31 pairs of the spinal nerves. Brachial plexus originate only from 5 of them. So C5, C, what it means?
Cranial.
Cervical related to the neck. C5, C6, C7, C8, and T1. What does it mean, T? Thoracic. So lower 4 cervical and first thoracic collectively form the roots of the brachial plexus. Now, after that, the roots of the brachial plexus will join, some of them will join together to form 3 trunks. So it will be better if we will draw diagram together with the explanation. So, that will be 5 roots. C5, C6, C7, C8, and T1. Now what happened? C5 and C6 join together to form the upper trunk. C8 and T1 to lower again join together to form lower trunk. And we still have C7, which is just 1 to form the middle trunk of the brachial plexus. So we have 3 trunks of the brachial plexus. I can show them here. That is superior trunk, middle trunk, and lower trunk of the brachial plexus. Now, these trunks, every single one, divided by 2 divisions. Anterior division, posterior division, anterior, posterior. Anterior division, posterior division. Anterior division, posterior division. What does it mean, divisions? That is very important conceptions. Right from the beginning, from the early development, like we look in the human embryo, we can see the buds of the limbs. That's future limbs. Mesoderm, the middle embryonic layer, primary germ layer, form a thickness in the middle, and this thickness finally becomes bone. And on front of this bone, future bones, and behind of them we have compartments of the muscles. Some of them becomes flexors, some of them become extensors. Right from the beginning we have 2 kinds of the fibers. Anterior divisions always supply flexors. Posterior divisions, right from the beginning, supply extensors. Is it clear? So, anterior division flexors, posterior division extensors. What happened later? Later they are mixed and form 3 cords. Cords located around of this huge artery. What name of this artery? Axillary artery. So, we have lateral cord, we have medial cord, and we have posterior cord. And all these names because of the axillary artery in the middle, in the center. Clear? Now, what's important to remember, that all posterior divisions, all of them without exceptions, join together to form posterior cord. So posterior cord will include only posterior divisions. What does it mean? That nerves which originate from the posterior cord may supply only extensors. That's right. Now, from anterior divisions of the upper trunk and anterior divisions of the middle trunk will form lateral cord, and anterior division from the lower trunk will form medial cord. So that is a medial cord, that is a lateral cord, and we have posterior cord. Is it clear?
Yes.
Good. And finally, from these three cords will originate 5 terminal branches. That's what we are worrying about. 5 huge nerves to supply muscles and skin of the upper limb. From posterior cord, we have 2 of them. The first one will be axillary nerve, and second one will be radial nerve. So from the posterior cord we have 2 nerves, axillary nerve and radial nerve. So here, that is the first one, that will be axillary nerve. And the second huge nerve over here, that is the radial nerve. Both of them originate from the posterior cord, so according to definition, both of them supply extensors. But in reality, this nerve, axillary nerve, supply deltoid muscle, which make abduction. Mostly we are worrying about deltoid. Okay? And radial nerve supply the rest of the extensors of the upper limb. Extensors of the arm, extensors of the forearm, and there are no extensors on the hand. So radial nerve does not supply any muscle in the hand. All muscles in the hand located only from the palmar surface. Clear? Now, from the lateral cord will originate 2 nerves again. This one, that is a musculocutaneous nerve, and one root of the median nerve. From the middle cord will originate again 2 nerves. Another root of the median nerve and ulnar nerve. So, in other words speaking, these 3 nerves which originate from the lateral cord and medial cord, these 3 will supply which muscles? I mean, what kind of the muscles of the upper limb? Flexors. So these 3 are responsible for the flexors of the upper limb. Let's take a look on them. This one, which has 2 roots, that is the median nerve. And median nerve, the most easy to find because it's the only one nerve of the brachial plexus which originate from the 2 roots. This one, which following behind of the medial epicondyle and on the side of the little finger, that will be ulnar nerve. So we already know median nerve, ulnar nerve. The third one, this one is not clearly visible good, that is a musculocutaneous nerve. Musculocutaneous nerve.